Hello. Hello, everybody. Thank you very much for coming. My name is Cecilia Anim, a nurse by background, and we are going to talk to you about new movement of improvement, as we know that the pandemic has taught us a lot of questions that need answers. We've all heard about the challenges the social care sector faced when COVID spread its harms in the care homes. It also seen outstanding staff and managers in the face of these challenges. COVID exposed the gaps in our health and social care delivery systems. These lessons have to be learned and acted on to address long-term challenges in our social care systems. Next slide, please. Social care nurses were selfless. This is what COVID taught us and brought to us conscious mind. They were compassionate. You went the extra mile to make sure that the most vulnerable in our society cared for with dignity and respect. This also revealed the impact of structural and health inequalities and the changes in delivering care in the workplace. The way we deliver care changed. It has also shone a spotlight on the critical role undertaken by nursing staff across the United Kingdom on a daily basis. Movement for improvement. This is what we think we need to do. We've seen the challenges. Now we need to find some answers to address these challenges. So the setting up for movement of improvement to be a vehicle to work with others to drive some of the identified changes through a shared vision and a fresh pair of eyes. We know that demographics are changing. We have an aging population. People are living longer thanks to medical innovation and treatment options. As a result, demand in health and social care will also change. We may not be able to meet expectations because we have reduced resources, systematic financial cut, and staffing issues. Next slide, please. The aims of our movement is to support and empower staff to take control. You need to take control on decisions that affect your practice. We need to support leadership, which is inclusive and focused on client and staff needs. Leadership that is not afraid to take risk and challenge. We need to actively support the demand for reforms. It's been a long time. We demand the reforms to be made visible because you and our clients need it. We need to encourage this through shared vision in planning, resources, and service provision. We want a new beginning to move away from the tick boxes. That has to go. And lessons learned without action need to be consigned to history. We need greater staff involvement and well-being support for you. Next slide, please. How we want to tackle these aims. We've taken 3, and my colleagues will address these. Leveling up disparity, integration, and recognition for social care staff. Movement of improvement, this is our vision. We want full engagement to give social care staff a voice for change. We need to create a platform for change, promise yet undelivered. We need a platform to share experience, your experience, through social networking, peer support, and for growth, and growth in career development. We need to address the identified gaps shown by COVID and this pandemic. Now leave to Claire to carry on, please.
Good afternoon, everyone, and thank you so much for joining us. My name is Claire Swan. I'm really privileged to be able to put my slides to you today. I'm a registered practitioner and I've been working in social care since 1995, so I'm not going to tell you how old I am. Anyway, levelling up and disparity. You need to be proud to be a registered nurse in social care. There is more to nursing than the NHS. Next slide, please. You're more than just a nurse. You're making decisions, you're working alone. You have no medical backup on site. So if you have a problem and you need some advice, you have to dial 111. You have to wait hours for a decision. Meanwhile, that person's condition may deteriorate. You look at the whole person and not their family and not just an illness. It's been tragic, the pandemic that we've had, and the NHS has had huge recognition for the pressures, particularly on ITU, which was lovely to see that they actually had 7 people that could turn one person and put them onto their stomach. That would be so fortunate if we had those sorts of staffing numbers working in social care. What they forget to say about, or what the NHS has forgotten to say about, is yes, how many people we had pass away that were living in care homes of all descriptions. Those people were not a patient like they were in ITU, where there was a short-term relationship. Those people were an extension to all of our team's families. So every time you lost a person, it was like losing a family member. So the grief and the torment that all of our registered nurses and our care staff felt when somebody passed away was far greater than that the NHS staff suffered from. Our relationships are in the long term. We don't generally have people who come in just to have for a short period of time, just to have a minor piece of surgery, or just come in and out of A&E. You have no access to medical records or computerized NHS records. We're out in the dark quite often, where you're having to make decisions based on experience and what the person is presenting with. We have no pharmacy on site, so you have medication issues. What do you have to do? You have to get hold of the GP or the pharmacy. You can wait hours for it to be resolved, and you have nobody to come and do your stock taking for you. You're doing a great job. You work in collaboration with lots of external agencies. You are more than just a nurse. Next slide, please. Now is your time to demand true recognition. It's the time for us all to get the true recognition we deserve. One of my goals would be to see Matt Hancock wearing a green badge, because he only wears the NHS badge. Let's empower our social care nurses. Let's celebrate the multi-skilled professionals that you all are, and have our voices heard so that we can influence the policymakers. We want ownership of some of these policies. So to do that, we must all get together so that we can have our voices heard in greater depth than has been heard so far. I'd now like to hand you over to Michaela.
Thanks so much, Claire. Hi, everybody. So I'm Michaela Russell. I started my nursing journey 10 years ago, and I've spent the past 7 years working in adult social care. That's why I'm really passionate about trying to move this initiative forward. Some may say that, you know, social care is all I know, and that's exactly why I love it. So I'm going to talk to you about one of the key areas that we've identified as a way to make this change, and that will be integration. We know that there's been a long calling for better integration and less burdensome bureaucracy within adult social care. The virus has made it clear that the time for change is now. Movement for Improvement aims to create a platform in social care to influence that change. Nobody can escape the impact that COVID has had on social care, and you don't need us to keep reminding you. We have seemingly gained overdue respect in the public, though, and the question is, can we continue to raise this positive awareness, championing social care? And if so, how can we do it? The NHS and Social Care Reform Policy Paper, which was issued in February 2021, called Integration and Innovation, Working Together to Improve Health and Social Care, highlights a proposal. It is designed to be flexible, allowing health and care systems to continue to evolve after this pandemic. Whilst the proposal is highly welcoming, and we can't help but feel that there is a continued focus on the NHS, with quotes such as "better equip the NHS" and praising the hard-working NHS staff. We already know that the council invests far less on systems supporting our adults in social care than the NHS spends on systems supporting acute, community and mental health trusts. How can we influence this change? How can we have our say? We would like to work together. We will be explaining our goals and ideas for the Movement for Improvement next steps, but for now, let's talk about how we can tell our stories, be the inspiration, raise what is great, and stop letting people talk this career down. I'm going to talk about leadership next. So one of the other areas that we've identified within the areas that we want to improve on is leadership. We have some fantastic nurse leaders in social care, and Movement for Improvement aims to create a networking platform to promote excellence in social care. We would like to further support a leadership culture in social care with a focus on the fantastic creativity and innovation that we already have in social care. We want to motivate and empower our nurses. And I'm going to pass over to Amelia to talk about how we can do that through recognition.
Hello everybody, my name's Amelia Greenwood. I've been a nurse for 25 years now, worked across the NHS, social care and independent sectors. I'm currently the regional clinical lead for local care force across the north of England. And like Michaela said, I want to speak about the recognition that I think social care nursing needs to start demanding. I don't think I need to remind everyone that last year, to say the least, has been unprecedented for all nurses, but especially for those working in social care. From the start of the pandemic, a lack of PPE and testing, ever-changing and contradictory guidelines, whole new ways of working, and the devastation that COVID caused across so many services has changed social care nursing possibly forever. There was one definite positive, though, that arose from the pandemic. Social care nursing was thrust into the public consciousness, receiving the type of recognition and understanding previously unheard of. Whereas historically, the general public may have lacked any real awareness of the role unless a loved one had been cared for in a nursing home, fellow nurses have often held long-standing misconceptions of the role, and that lack of recognition has been pervasive. An outdated perception of care homes and the role of nurses within social care, that they're task orientated, a job you do when you can't get a job in a hospital, or maybe when you're close to retirement and want an easier life. Nursing in social care has become one of the least travelled paths of the profession. And this is one of the things that we hope Movement for Improvement will not only address, but will initiate change across the sector. Who, if they haven't worked in a home, would know the extent that we support residents with their emotional, psychological, social, physical and cultural needs, recognising each person's unique qualities and history. You're working in that person's home. You'll get to know them as individuals and their families in a more in-depth way than in any other branch of nursing. Not only do you have to be competent in a wide range of clinical skills and have amazing time management, 12 hours can fly by during a shift. You've also got to use your initiative. If a peg feed starts beeping in the middle of the night, or a catheter needs to be replaced twice in as many days, and you don't have a spare, then you have to sort it. Working with physios, SALT teams and OTs to support residents, learning skills we might never have gained as hospital nurses. Negotiation is always a valuable tool when working in a care home setting. We also work with GPs, pharmacists and social workers, amongst others, and electronic care planning and EMR systems mean we have to be technologically savvy now too. One of the great positives of working in care homes is their vibrancy and diversity. It's a nursing path where you can be taking clinical observations 1 minute and running into a therapy donkey the next. I don't think this level of diversity appears in any other branch of nursing. Social care nursing is challenging and certainly not boring by any means. It has often been treated as the ugly sister to the Cinderella of acute hospital care, but it does have its own challenges and moments of fulfilment, and I couldn't agree more with the latter. And by not having the recognition the role deserves, by not promoting the role amongst student nurses, colleagues and the wider public, are we agreeing with the myths and stereotypes of social care nursing, and in turn saying that nursing home residents don't need or deserve the best staff? Whereas the NHS is a huge machine and nurses are just a tiny part of it, those of us who've worked in a care home setting know how it feels to have a sense of belonging and clinical credibility that actually comes with the role. We hope, with the support of yourselves, nurses across the social care sector, want to build on the awareness that COVID-19 has shone on the role. We want to support nurses across social care to shout about how amazing our role is, to support nurses to share best practice and support each other. And in doing so, enable nurses who may have never considered the role before to take up this fulfilling challenge and change those long-held misconceptions of nursing in the social care sector, which surely can only benefit the people we care for every day. Thank you for listening. I think it's back to Michaela now.
Yeah, so when we discussed the sort of foundations of this new initiative, we took a lot of inspiration from Professor Deborah Sturdy, who we are delighted to have here with us today on this sort of launch webinar. I don't know how many people have been able to listen to Deborah's podcast with Care Talk, but we have taken away some really valuable messages that we feel can, you know, begin the conversations, and they are: we need to change the narrative. Care homes are nurse-led services, often caring for complex individuals and making complex clinical decisions. We're often alone, but we are autonomous. We need to talk up the skill set, looking at specialisms for nurses in social care. And Deborah suggested providing exposure and experience to undergraduate medical students and therapists alike. We need to look at the parity and the equity in accessing the training, learning and development that our colleagues in the NHS get, as well as sort of levelling up with the terms and conditions again, as our colleagues in the NHS get. That will hopefully then come with it an anchored respect that we also deserve. Hopefully today, Deborah will be able to elaborate on some of the things that she spoke about in the podcast and give us some talking points, open up the conversations about how we can achieve our goals with the help of the attendees today. Hopefully people would like to join this movement. Hopefully we can provide this platform and a network where we can all support each other. I don't know if Deborah oh yeah, lovely. Just a delay there on the transfer. Welcome, Deborah.
There, can you hear me?
Hello
there?
Hi.
Hi. So that was really interesting listening to all of you this afternoon. I've been in post now for I suppose 3.5 months really, and it's been a really interesting time. I think it's fantastic that the government have actually had the vision to appoint a chief nurse for adult social care. And I think that we have to remember, listening to you this afternoon, it's not just social care nursing doesn't just happen in care homes. It happens across the whole breadth and all the subspecialties that go with that. And I think that, you know, listening to you, I think there's a few challenges I'd probably throw back in terms of Matt Hancock has actually worn his badge in public. I've seen it myself many a time. And I think that what we shouldn't do as nurses in social care is be defensive. We are one profession. So I think, you know, to be saying the NHS get this and social care don't get that, I think we should just remind ourselves that we are actually one profession and we're all trying to do our best by the patients, the people and the residents that we look after. And I think that's a really important statement. One of the things that I think is really important about the role that I have is that I link in with the chief nurse of the NHS. So I have a seat at the table of Team CNO, which means that the kind of conversations that I have on behalf of the sector are actually quite powerful because they are straight into the ears of people who are actually leading quite a lot of change at the moment. And there's a huge amount of change going on across the system. one of the things, well, I have several objectives. One of my objectives is actually about the recognition of nurses in social care, and shortly I'll be announcing the launch of a scheme around that. The Nursing Times is going to be ensuring this year we've actually secured an award for nurses working in social care, and I know that the sector are phenomenally brilliant at celebrating the workforce across the whole of adult social care, but actually this is a first award that will sit alongside all the other dominant kind of NHS type awards that go on. So really important that we make that mark on that national kind of platform and professional in that professional arena. I know that you've touched on the whole thing about education. Education is fundamental, I think, both in terms of the postgraduate opportunities that we might be seeing and the NMC consultation that's out at the moment. And as you rightly say, that undergraduate experience, because if we influence the undergraduates, you know, they will be the A&E consultants of the future, receiving people that, you know, that are sent in from their own homes or, you know, other care settings. So to actually have an understanding of social care, I think is absolutely fundamental. And when I did my training over 40 years ago now, you know, I actually worked in a care home at that time, and I remember that experience like it was yesterday. It was very, very, you know, had made a real mark on me. So I think it's really important that we open our doors in a very collegiate and friendly and positive way to bring people in. And I think the other thing about, you know, this changing of the narrative, absolutely, you know, we have to stop talking ourselves down and start talking ourselves up. Careers in adult social care should not be a kind of a second-rate option. They should be a first-rate choice. So I think we have to, again, be confident amongst ourselves and actually sit around those tables and actually have our voice heard. I've set up an advisory group, the first meeting of which will be this week, and that's with a range of people who are there to represent their view. My view is my view. I want to have all those people, not just registered nurses, but, you know, frontline healthcare workers, domiciliary care, you know, people who are working in learning disability and autism services, so that we have some really important, grounded thinking and experience that's actually informing the kind of role that I play in supporting ministers and senior civil servants as they develop policy for adult social care. And I think you're right, you know, our time is now. We are, you know, looking at social care reform. We're looking at a workforce, you know, a workforce plan alongside that. Yesterday I was at the Public Accounts Committee and was talking to them about workforce, that, you know, we have to create not jobs but careers for people, and what a fantastic place to do that, and the myriad and the variety of services that offers. And I think that this is the time is now. Timing is everything, and the timing is now for nurses in adult social care to actually step forward, step up and be heard. Thank you.
Oh, lovely, thank you, Deborah. I think one of the discussions that we had as well, talking about the differences with NHS and sort of social care, and yes, not being sort of defensive, we spoke there is possibly disparity between different providers within sort of adult social care as well in the different areas. So I think your advisory group, you know, involving all of those frontline workers sounds fantastic. And how else do you think that sort of nurse leaders or nurses can get involved with this sort of movement, and how could we make our voices heard?
I think that, you know, talking matters, talking to each other. I think one of the things that was positive that came out of the winter plan is that, you know, 11,000 iPads went out to the service, you know, to all those services. So and the virtual world that we live in now, as we're having this conversation this afternoon, actually it's about getting people to use that to connect within their communities, connect with each other. And I think, you know, one of the other things that's been really positive, you know, bearing in mind up until January, I was leading a service and kind of worked throughout the whole of the challenges that the last 14 months have brought to us all at the front, you know, at the front line in the Royal Hospital, Chelsea. So I think it's really important that we use that capability that we have. we've got the Queen's Nursing Institute, we've got the nursing network there, which is, I think it's got over 800 participants now. Skills for Care have got a registered manager network. I think they've got 1,000 participants. There are forums that exist, and I think it's, and like the conversation today, it's using all of these opportunities for people to not only get their voice heard, but actually learn from each other and support each other, because the pandemic has worn us all out. We need to kind of maintain our energy going forward. So actually talking is really, really important.
Definitely, yeah. Okay, thank you. I think Jo is going to open up some Q&A time, Deborah, to see if there's any participants that wanted to put into the chat box any direct questions that they have with you. But perhaps we could move on at the moment for our next steps and things.
Yeah, sure. I'll just get the next steps up.
If anyone does have any questions for Deborah, please pop it into the chat box at the moment.
Our next steps, we want to engage in regular talks with key stakeholders. It would be lovely to be involved, perhaps with what Deborah was saying, with some of the forums and other organisations that have ways to collaborate so we can all talk together. We want to showcase best practice, and perhaps there can be some articles, and I'm very conscious that lots of articles are written in lots of other journals, Nursing Times being one of them, Nursing Standard, and the RCN have lots of things, but also with Care Talk magazine, which is predominantly around social care rather than the wider picture of nursing. So perhaps it's, about focusing in on the social care side of the nursing. We'd love people to complete a survey at the end of this webinar so that we can take your feedback on how we can move forward. But likewise, anyone that's really interested in being heavily involved with this, we would welcome with open arms, because I think the more of us with all our different experiences, we've all got such a lot to offer. I think it's crucial to get our voices heard, that we all collaborate together. So please, if you're keen to join this movement, please put that in your feedback, because we would love it to be a bigger audience that we're talking to. We will be sending out a link, and we're going to have MFI. It's a bit worrying, because that was the old MFI furniture, which everyone called Made for Idiots, but this isn't about being made for idiots at all. This is, there's going to be a Facebook page with updates and peer support. And again, we can learn so much from each other. And I think if we can have a voice where we're talking about the things that we're learning, and we're trying to influence the policymakers, and raising the profile of social care a lot more. I think you're right, the pandemic has really helped with that. We will set up a confidential email address, which will be sent out to everyone, so you can tell us what's going on. It can be anonymous if you'd like it to be as well. We're very conscious, obviously, of GDPR, and people might want to keep things confidential. So that's our next steps at the moment. So who's doing the questions? Cecilia, is that you?
We've got a question for Deborah. So Deborah, as a domiciliary provider, we would be very interested to find out more about the follow-up group you have coming this week.
Yeah, so this is my personal advisory group. As I say, my voice is my voice. My opinion is my opinion. So what this group's, why I've set this group up is to inform me, and that's why I wanted it to represent the kind of widest workforce of adult social care. So there are people there, they are there to represent, they're not there on behalf of their organisations, they're just talking about their personal experiences as frontline workers. And what I've done with that is that I've actually set up, and so there's limits to that, so it's a 2-year kind of tenure on that advisory group, because I think it's really important that we keep that kind of refreshed. So there is representation from people currently working in domiciliary care services.
Great. We've got a question for the Movement for Improvement founding members as well. What makes this network different to other nurse support networks?
What makes this movement different is that we have set ourselves up. We are not looking for funding from anybody. So we are a self-help group trying to engage with other like-minded nurse leaders to be able to support us to take this message forward. So it will, I know there are a lot of other organizations around, but one of the aspects of moving forward is also networking, because there's no need to reinvent the wheels. So if something is happening that you can support, then we will do that. So, you know, we are a standalone movement, therefore we will do our best to move this forward.
Yeah.
And actually, whilst I'm on, I want to ask Deborah one question, please. The leveling up, is there any work being done at the moment on the leveling up of social care with NHS staff terms and conditions of service?
Well, no, because this is a question that came up yesterday. The Public Accounts Committee, you know, they are private providers. So it's not like the NHS that there is a national service and that there are national terms and conditions set.
Right.
You know, that there isn't, you know, there isn't that infrastructure to do that. What does happen is that local authorities negotiate about those kind of pays within local contexts. But there is not a national, you know, it is a completely different sector with a completely different setup.
Okay, thank you.
I think as well, just to add on to Cecilia's comment about movement for improvement and why we're different, and you know, having access to the Great British Care Awards, nurses within social care. As I said previously in my slides, we have some fantastic nurse leaders. We have access to those nurses that have demonstrated outstanding practice to get feedback, to really speak to frontline staff.
Thank you.
Got another question for the founding members, actually. What will you do to ensure you will make a change, and more importantly, make a lasting change?
Well, I think there's, you know, lots of changes, and as Deborah's already said, there's things in the pipeline really that are already happening, and, you know, work that's been done, and sort of lots more positivity about social care we feel over the sort of pandemic, and really focusing on that and using what Deborah said, you know, now is the time. We don't expect to make changes immediately. We expect perhaps to have some influence over supporting nurses within social care, making small changes perhaps for big wins, because people's well-being and feeling listened to and feeling heard is, you know, imperative. And I think that personally for me as a nurse within social care, that's, you know, the priority is now to get over the exhaustion, to feel heard, to feel listened to be optimistic for the future, to talk about our stories, to really, you know, make people aware of the brilliance and the excellence that happens in across all of the sectors in social care.
We've had another question for you, Deborah. Says, I have to beg for training for my staff. A lot of this training is easily accessed for the NHS staff, but not for us in social care. I also have excellent nurse assistants who are not allowed to perform certain tasks such as venipuncture, yet care assistants within the NHS can do this. These are only some of the disparities between social care and the NHS. I hope you are successful, Deborah.
So I think if you think about, there are quite a lot of opportunities for learning and development through Skills for Care. They have some central funding from DHSC, and run, you know, and help employers to access various you know, funding streams around apprenticeships and learning and development. I think one of the opportunities around the integrated, you know, the ICS's integrated care systems will be perhaps greater opportunity for, you know, addressing that learning and development. And again, you know, employers, it's back to the point with Cecilia, you know, as private employers, people have responsibilities for setting the terms and conditions and actually the training for their staff as well. So, you know, we are trying, you know, they are different systems. You know, it's a national system versus a, you know, a predominantly private market. So it is what it is. It's different. So but I think the ICSs will actually help with that integration, and the white paper around further integration with health and social care should be helping that, because systems should be working together to find solutions. And if we, and I would suggest that by training anybody working in a care home with the appropriate skill and knowledge and oversight to do venipuncture might actually help the wider system. So that's a great example where investing in that type of training, as long as that person is competent and is supervised, and there is an accountability framework in place, then actually that helps the wider system. So I think that's, if I was working in an ICS, that's how I'd be thinking about this. There is opportunity for things to come together and build on the kind of mutual aid offers that have happened, and the support that the NHS have given over the last 12, 14 months. And thinking about things like the Enhanced Health and Care Homes programme, and the support, again talking to those local PCNs about what could be offered and what the possibilities are. And I'm sure there's somewhere in the country that's already ahead of the game on that one.
Yeah, I'd like to just to come in there. We've managed to access some workforce development funding for that very same thing about raising our non-registered nurses, the clinical skills of our non-registered practitioners, which we work with the local authority for to get the funding. And I think we've got just over £7,000, which will enable us to get 6 people to enhance their clinical skills, not only venipuncture, but there's also catheterization and various other things that they can do. So there is resources out there. You just have to keep hammering away to access them. But I think Skills for Care are very helpful as well with the Workforce Development Fund. So please contact them, and they'll give you lots of information about how you can claim that money.
That's really
good. If somebody wants to contact me about it, I'm more than happy to share how I've managed to secure the funding for my small organisation.
I think it sort of raises a question then around communication, doesn't it, to other sort of care providers, and whether the leaders of these private care homes or domiciliary companies are passing those messages down too, and sort of raises that as a question too.
Well, there's a great article, Claire.
Yeah.
How you've empowered your staff. There's a great one by accessing that funding to make a difference to residents.
Yeah, and also it makes a huge difference to the staff as well. And we have, I haven't actually got nursing homes where I work at the moment, but we're working very closely with district nurses and other senior practitioners within the GP surgeries, and also the care homes team, which is a group of nurses that support our care homes from the PCN. So there is facilities out there, but you do have to keep on at people and keep pestering to get what you want. So you get to be a bit like a Rottweiler, get something between your teeth and don't let go till you get what you're after.
And if it works, it works.
Yeah.
I have another question for Deborah. I know you mentioned that because care homes are privately owned, they can not be equate to what is happening in the NHS in terms of terms and conditions of service, training and development. But because they are also managed by the local authority, is there a way, because it is within working and caring for people, and there are safeguarding issues with regards to training and development for staff to give the appropriate care. Is there a way that we could make it an obligatory to set the minimum standards for people working in care homes, the minimum standards?
On the phone. The local authority don't manage care homes.
Yes.
They don't manage care homes. They commission care homes.
They commission it, yes.
Yes, they're commissioning it. So again, there's potentially opportunity for them to look at their local markets. But central government does not set rates of pay for the sector. It doesn't, it is a private market. I think that with the workforce reform agenda, that has to have some underpinning skills and knowledge framework to it, because we need to develop and grow that workforce.
Yeah.
But you know, that is about local decision making. And it's back to Claire's point, you know, when you've got things like the Workforce Development Fund, which is not insubstantial, that's kind of that Skills for Care can help you access. You know, this it is about, you know, it is about providers doing some, you know, there's stuff there available to them. It's accessing that. So it's back to that point actually, and I think it's Michaela's point as well. It is about sharing and making everybody aware what is available to them.
Thank you.
Just another question for Deborah. If there was a national commissioning strategy that was in place for each local authority to follow, would that be a vehicle to better the terms for nursing working in social care?
I think we don't know the answer to that. I don't, you know, there's not, I'm unaware that there's an intention to do that at the moment. At the moment, it's through local authorities and local markets, because they're the people who are, you know, at that kind of coalface, knowing what's going on within those local markets.
Okay.
And then finally, one last question.
Sorry, can I just say a bit more about that? I think one of the issues that we have at the moment is the disparity in the fee rates that you get from each local authority. You know, one local authority might pay you £600 a week for looking after somebody, yet a local authority that borders on the same county, you know, off the county, might give you £800 a week. So there is huge disparity between local authorities and the funding rate that you actually get for caring for people in care homes.
Market driven.
Yes, the last question. Paying conditions are key, and appreciate the difficulty in regulating this in social care with our sector being independent businesses. However, could the government develop a suggested pay scale for social care nurses on a par with NHS, of course? Or is the difficulty with the suggested pay scale the fact that local authorities would be required to pay providers more to enable them to meet the suggested pay scales?
I think, you know, there is not an intent that I'm aware of that for that to happen at the moment. Like I say, I think, you know, with the social care reform that's been, you know, that's going to, as we go forward, that's been much awaited, and you know, and I think somebody referred to in their talk earlier that, you know, it's been decades in the waiting. You know, it remains to be seen, you know, what any of that might look like at the moment, but I'm unaware at this time that there is an intent to do that.
Thank you.
Yeah, I think that's it. So I don't know if you had any closing words, Sis.
Okay. Thank you, Deborah, for giving up your afternoon to be with us and to answer these questions, and also to give us an insight into what is happening in social care at the moment in the wake of this pandemic. I know there are a lot of things in the pipeline. So if there's any way that we can support you, we will support you. If there's any way at all, we will support you. And I think after today, we may also have other people on the pod wanting to join us. And I think if we can get the numbers and get the right messages across, we may be able to make small steps as we are anticipating. COVID-19 has really highlighted a lot of things that need to be approached so that staff and care home residents have the appropriate care they need. The change will only happen if we decide to show commitment and then support for those in social care and their families. And as the president of Sierra Leone, Ellen Sinceri, I always quote her. She said, if your dreams does not frighten you, they are not big enough. This dream is very big, but it doesn't frighten us. So we will do the best we can for the people in the social care sector. But you can count on us, and we will count on you. Thank you for coming.
Thank you very much. And yeah, and it is about everybody. So thank you to everybody for everything that they're doing.
Thank you.
Definitely.
Lovely.
And I want to thank those who have taken their time to come this afternoon. Do your questionnaire, and then based on the questionnaire and the answers, we will get back to you. We also want to create something like, I hate saying champions, I want ambassadors to support and to network supporters, yes, to support us in this journey. So if you feel you've got the buzz, please leave your email address on the questionnaire so that we can get in touch with you. And thank you all very much for giving up your afternoon. You will be hearing from us once again. Thank you.
Brilliant. Thanks, everybody.
Thank you. Thank you. Bye-bye.
Good.